Good morning, everyone, and welcome to the Managed Care Data Quality Monitoring webinar. We are going to be speaking about managed care program data and primary care provider assignment files today. We are going to give folks a couple minutes to come on. I know that we have a few more people who will be joining us. So until 10:02, that's when we'll start this. Thank you so much. Okay, folks are coming on slowly. We're going to give people another minute to join us, and then we shall start. Please remember to mute yourselves as you come on, and do check your speakers. Make sure you can hear us. Thank you. All right. Again, I'd like to welcome everyone to the Managed Care Data Quality Monitoring webinar. We're going to be speaking about the managed care program data and the primary care provider assignment files related to the expansion. And we will begin now. My name is Amy Peterson. I'm the Managed Care Data Support Section Chief, and I work here in DHCS. Next slide, please. We have a lot of support to be able to provide this webinar to you. For starters, the speakers today are myself, Deborah Dixon, Sean Barber, and Kudzai Nyandoro. I'm sorry, Kudzai. I will say your name properly. Nyandoro. Our support staff are Atif Habib, Samantha Van, Abi Geber Salasi, Mei Shan Ang, Brianna Saley, and Soo Jung Kim. And those folks are all organizing this webinar and making sure it's happening. Next slide, please. The agenda today will be the data quality monitoring standards and objectives. Again, the MCPD and PCPA data submission standards. MCPD quality monitoring status.
2 weeks.
And please go ahead and make sure that you're muted. We're recording this for being able to post on the webinar page. MCPD quality monitoring status, MCPD PCPA business use and future plan, and we're not going to be talking about ECMCS today. And communication later. Thank you so much. Can you figure out who? Again, please go ahead and mute yourselves. Thank you. The data quality monitoring objectives today will be that we receive and review EDI transaction data from the managed care plans, counties, and they go into the post-adjudicated claims and encounters PACES system, and the PACES data processing flow is over here on the right. And you can see as the managed care data comes in, it goes through a quality check that tells whether or not we will accept or reject that data. And if it's rejected, then that particular file goes back to the managed care plan at the county, and the whole thing has to be replaced. Again, that's part of our CART system. So we monitor the CART of the EDI transaction data as that data is coming into our system. Next slide, please. So CART dimensions include completeness, accuracy, reasonability, and timeliness. And for completeness, we're looking for missing or duplicate data. You could think about it as like the essential data details, like a valid city or county code, the type of facility, etc. Accuracy is looking for typos and questionable records. We catch things like site email addresses using strange or forbidden characters. Sometimes multiple and misspelled addresses. We flag those. Reasonability is if that data is valid and plausible. If there's like a large change and it's unexpected, there might be a check. Timeliness, that day is always the 10th day of the month, to my knowledge. And that data comes in, it's submitted, and the submission date and time is taken for the most recent submission. And then it needs to be in before midnight on that submission day. So that's kind of a overarching understanding of like how the data comes in and what some of those standards and quality checks are. Next slide, please. The quality review reports consider submission timeliness of things like the 274 file, which is that managed care and fee-for-service provider file, and those files, in addition to several types of data quality measures related to reasonability, completeness, and accuracy of that particular data. Next slide, please. And I'd like to introduce you to Deborah Dixon. She'll be speaking next on the MCPD and PCPA assignment data submission standards. Deborah is our data quality branch chief. Welcome, Debbie.
Thank you, Amy. As Amy mentioned, I am the data quality branch chief here in the Health Information Management Division. And so before we get started, we're going to go through the data submission standards and data quality checks and such today. So just keep in mind that we're talking about medical managed care plans and how we do things today in terms of the submission standards and quality checks. I know there may be others on the phone that maybe aren't from managed care plans. So just to be clear, this is specific to them today. So next slide, please. All right, so we'll start with what the definitions are for the managed care program data and primary care physician assignment. So for the program data, we're talking about data elements that are used by the plans to report their grievances, appeals, continuity of care records, out-of-network requests, etc. here sent here to DHCS. And those 4 data types must be submitted to our post-adjudicated claims and encounter system, also known as PACES, in a single monthly MCPD file in the JavaScript object notation, also known as JSON format. The primary care physician assignment is just as the name implies. Same thing, the data must be submitted to PACES in that single monthly file in that JSON format. Next slide, please. So the requirements are in the all plan letter 20-017. There's a link here. As mentioned earlier, there is a web page where you'll find all of these recorded in PowerPoints that you can access. So you could click on that to get to that document that shows all the requirements. And there's also the technical documentation, and the JSON schemas can be found in the document in Documentation Center. You can see that link there. You could also click on that to get to the documents that tell you the technical structure of what it is, the detail needed to build the files, the data element dictionary, record layout, response file messages and error codes, examples of files, that type of stuff is in the technical documentation. Next slide, please. All right, so the submission rules, we've got a few things to talk about today. So the prior month reporting data must be submitted by the 10th of the month. So as you see here, the example, if it was January 2023, it must be submitted no later than February 10th the following month. It must be submitted to the SFTP section using that JSON format that we've talked about. A validation response file is generated for every submission to check if the file conforms to the data schema, which we talked about can be found in that technical documentation. And plans are required to resubmit files that response list as rejected due to errors in the submitted file. We're going to go through each of these points right behind this. So next slide, please. All right, so the submission rules, we've got the SFTP, the Secure File Transfer Protocol. Each plan has the accounts and access for their folks to access and upload that program data to the site. Each plan has two sets of folders. There's a test and a production, and inside those, there's a submit and response for each of those. So the plans must submit the program data files in the submit folder, and then our PACES encounter system will automatically pick up the files for processing. Once it's been successfully processed, then it'll be removed from the submit folder. So something to keep in mind, please don't change the folder structures at all because that would disrupt the file processing and result in files not being accepted here at DHCS. Next slide, please. So the validation response file is returned to each response folder for each one of the program data files submitted. Now that response file will provide the details on whether the file was accepted or rejected in its entirety. It's not a partial file acceptance. We either take it or we don't. So if a file is rejected, that response will include information on the errors that occurred in that file. And again, you can find that information in the technical documentation. All of those errors and such are listed to help you figure out what to do to fix those and resubmit. Because the plans must monitor those response folders and review those files in a timely manner to make sure that you capture anything that's been rejected for resubmission. So next slide, please. So resubmission of the files, if it's rejected, it must be corrected and submitted. A whole new file, as we just mentioned, by the 10th of the month. The file can't be corrected at the record level. Again, it's an all or nothing, so an entirely new file must be submitted. So the submission reconciliation form is another tool that we use to the information collected to validate the transmitted files to ensure data completeness. So as part of that, the CART requirements that Amy was showing you, this is a part of that, the timeliness piece. So each plan is required to complete and submit that form by the 15th of the month following the submission month. And that is used to track all of the information that you see there, the 274 provider, the program data, the physician assignment, and then the encounter data file submissions. So we use that to validate that all of the transmitted files were received. All right, next slide, please. So here's an example of the naming convention. So for both MCPD and PCPA, you see the what that should look like. Again, that's in the technical documentation connected to this requirement. So the X's is the name of the health plan, and the spaces are represented by dashes. That's really important. Whatever that structure looks like must be followed. So you would need to make sure you have spaces rather than an underline, for example. So the type there you see in yellow, that's the type of file that you're submitting, whether it's the PCPA or MCPD. And the date must be entered just as you see it there with all 4 digits, starting with the year and then the month and then the day. And the ends that you see in that naming convention is the numeric transaction identifier. So it could be that plans would submit more than one on the same day. This differentiates those from each other. And then as far as the structure goes, each segment in the file name must be separated by an underscore. Again, it's very important to follow that exactly, or those files would not be submitted or accepted. All right, so you see the same thing on the response file there at the bottom. The X's is the input file name, and for an example, you see on the bottom there, My Health Plan, MCPD, etc., just so you can recognize what the response file looks like. All right, next slide, please. So here are some common errors for rejected files. So you see how this looks now. I think, there you go. I was going to say, I think this is a fancy slide where we're going to do line by line. All right, so the status shows accepted or rejected is what's expected. All right, next point, please. So in this case, it's rejected. So why would this one be rejected? Let's see what the errors are. So the My Health Plan, as we just mentioned, should be hyphens and not underline. And there's some letter transposition there. It should be MCPD for Managed Care Program Data, and they've got the opposite. The date format must be the year, then the month, then the day. They've got the year, then the day and month, so that doesn't follow the protocol. And then the last piece is there's an O in there rather than zeros, so they need to replace that so it's all zeros. That is a fully numeric structure that must be followed. All right, next slide. Now we're going to talk about the monitoring status. Next slide. So timeliness checks, we just talked about that. To be considered timely, files have to be accepted at DHCS by the 10th. So that's an important distinction to make, because sometimes there could be some delays in the PACES system. Maybe there's a backlog of processing in PACES, or maybe a rejection could occur. So you want to keep that in mind when submitting the files to make sure it's accepted by the 10th of the month. And then the verification response file does produce warnings for the files that have discrepancies against PACES. So again, those responses are uploaded to the plans folder in the SFTP site. Next slide, please. So here is a couple of examples, the error codes and the warning codes. So you see the structure of the error codes. They start with 0x03. And you see in the blue boxes there what the code would be and what the error message or warning message would be. And the error message, it does show the fix would be to resubmit the file with the correct receive date. The error is related to the date structure in this particular case. The warning codes, 0x04, warnings don't always result in a rejection. However, you need to take a look at those in case it does become a future issue and make sure that you fix whatever it is or identify it. In this particular case, it shows a service location not in California. So you'd want to make sure, even though it's not a rejection, you want to look at the warnings and make sure you fix those, or make sure what was sent was accurate and legitimate, so that there's no future data issues. All right, next slide. Okay, I am going to now turn it over to my colleagues, Sean and Kudzai, to talk to you about the business use and future plan.
Hey, thank you, Deborah. And good morning, everybody. My name is Kudzai Nyandoro. I have a couple slides here that I'll present. The first one is on the business use of the managed care program data. So the appeals and grievance data are reported in various DHS dashboards, and this includes the quarterly MCP dashboard. Now, plans participate in the quarterly monitoring, where DHCS sends the quarterly monitoring performance report via SFTP site. And then in return, the plans respond with a narrative on the quarterly monitoring response template. DHCS reports appeals and grievance data to the Centers for Medicare and Medicaid Services on a quarterly and annual basis. And then regarding the future plan, the following changes are in progress to benefit type. The mental and behavioral health is being updated to outpatient mental health and all substance use services. And then the California Children's Services is also being updated by adding whole child model to the end. So in full, it will be California Children's Services / whole child model. 14 specific supports are being added also. And then finally, grievance types are currently under review, and DHCS may survey plans to identify any necessary additions. In the meantime, plans can use the provided email address, which is mcqmd@dhcs.ga.gov, with any additions for DHCS to consider. So feel free to reach out using that email address if you have any ideas. That's it from me. I'll pass it on over to Sean.
Thanks, Kudzai. Good morning, everyone. My name is Sean Barber. I'm with the Managed Care Networks and Access Branch at MCQMD, the Department of Healthcare Services, and we'll talk about the business uses and future plans for the primary care physician assignment file. So as you can see up on the screen, there are, a few different uses for the primary care physician assignment file that span enrollment, compliance monitoring, population health management, and other analytical functions. Specifically, the primary care physician assignment file is used as an input to the provider linkage process, which is used during member enrollment. It's worth noting that this is the primary care physician assignment files for plans that members may be exiting when they're potentially going into a new plan, where it's used as part of the linkage process to determine whether or not their primary care provider is in network with a given managed care plan. It's used to validate various managed care plan compliance monitoring deliverables, and the networks team also uses it to assess and validate plan reported information on impacts from provider and subcontractor terminations. The files are also used for various population health management functions related to primary care. And as I mentioned previously, there's a variety of ancillary uses for DHCS analytical functions and research purposes. Next slide, please. So there are future plans to potentially update this file. DHCS has set up an internal work group to identify potential adjustments to this file to better meet Department of Healthcare Services needs. As DHCS goes further on in the development process and conducts those internal meetings and activities, we will be engaging our managed care plan partners during the research and development process. So as you know, right now, the primary care physician assignment file is a fairly simple file. Medi-Cal SIN or Medi-Cal member SIN and the MPI to which they are assigned. And DHCS is looking to expand upon that file to provide a more holistic view of how members are assigned in the organization. An example is delegation to other entities is pretty prevalent in the Medi-Cal program with our managed care plan partners. And so potentially updating this file to better track where members' lives have been delegated is one of the future plans under discussion. And I think that rounds out the slides that I was responsible for here today, but any questions on the business uses for either MCPD or the primary care physician assignment file or any of our future plans?
There are some questions, Sean, if you'd like to take some of those now. There's a question about the estimated date as to when these managed care plan data changes will be required. And I believe Kudzai had covered a lot of that.
Yeah, in terms of the primary care physician assignment file, we're at what I would call kind of the stages of infancy in our research and development process. And as mentioned, we'll be sure to engage our managed care plan partners appropriately when we get a little bit closer to rolling out any potential changes.
We had a question from Janet. We are trying to track provider data discrepancies at the managed care plan level and with healthcare options. What is the process for the MCP to reconcile primary care provider data, FQHC sites for Medi-Cal in the 274 file to the PCP data in their internal systems used for patient assignment? And I'm guessing that might be a better one to take back for Debbie, but they also asked, what is the turnaround time if a provider update is made in the internal MCP system? Yeah, this seems like it's going to be information that Debbie can catch at the end here, but I wanted to make sure that we were able to get Sean and Kudzai available for anything related to program specific questions and answers. I'm not sure if you can stay for the rest of this. But yeah, if you have questions, definitely put them in this chat. We are collecting them. And if we don't catch them today, we can get back to you with a specific subject matter expert who can answer that question for you. So you can also email us at dhcs.dhcs.ca.gov, and we can get that information back to you as well, and make sure that your question gets forwarded on to the subject matter expert who can best answer it.
Thanks, Amy. And real quick though, I might want to hear a little bit from Janet. One, what organization you're with, and two, if you wouldn't mind coming off mute, Janet, and talking a little bit more about your question. I mean, right off the bat, the 274 files submitted to the department by managed care plans. So when they make those updates in their system, we would expect the 274 file to be updated accordingly. So perhaps you can hop off mute and talk a little bit more about some of the reconciliation of PCP data, FQHC sites, et cetera, that you mentioned.
Yes, hi, Janet Badicum-Cherry from Health Center Partners of Southern California, with our corporate office in San Diego. It's a FQHC consortia. We have Indian Health Centers and also Planned Parenthood of the Pacific Southwest. So we're doing some directory audits. We're finding some inconsistencies when we go onto the healthcare options website to try, to assign a member to the clinic, for example, our clinic. For different health plans, the data doesn't seem to be always showing by health plan. And sometimes I think the credentialing folks are doing some, ICE roster updates, and that data is trying to get captured internally at the health plan level. One of the payers suggested that there are two different systems and they don't necessarily talk to each other. So some of the issues we might be seeing is just the ability to reconcile how the health plan is assigning patients at the local level, even if that's some like San Diego level or even a California level, but then what goes in the 274 file, there might not be, my assumption based on what that comment was, is that there might be a disconnect in the internal data versus what's ending up in the 274 file, but I don't know. So I know I'm kind of backing into the beginning part of the process and probably not specific to this meeting, but we do have two health centers that put their NPI in healthcare options right now, and one of the Medi-Cal payers they don't show at all, and that's a new issue. So we don't know why there are discrepancies, and now we have a newer issue of what's happening.
Thanks, Janet.
Yep.
Thanks, Janet. That's really helpful. I suspect your question may be oriented towards perhaps some of the alternative payment methodology discussions ongoing. However, there's a lot to unpack with your question, right? So healthcare options gets data from the Department of Healthcare Services. So you have a few different systems at play here. So I think we don't have all of the appropriate folks on this call. So I think this would be a question that would best be addressed offline, but just so you understand how the kind of data flows, right? From the plan to the department, healthcare options, et cetera. So there's a lot of different systems at play, and potentially data lag comes into play as well.
Mm-hmm. And it actually was not APM driven, it was redetermination driven. And we have two Medi-Cal plans exiting San Diego in January 2024, and we don't want them to lose their primary care assignment. So there's been a multi-month effort to try to do some reconciliation and make sure the data is accurate. And it was more driven off of the redeterminations than payment reform.
Gotcha, that's helpful. And the transition, it sounds like, as well.
Yep.
Yeah, so as part of the, and I'm not an enrollment SME, but I can tell you there's a provider linkage process incorporated as part of the transition on 1/1/24, where PCPA data from the exiting plan is used to determine whether or not there's a linkage with a potential incoming plan. Right. So it is incorporated as part of that process.
Okay, thank you.
Great question.
A couple of questions related to changes to the MCPD JSON file. And I'm not sure, Sean, if you can answer these, but will there be any changes or will there be a version change? And do you know approximately when that will be required? and what kind of specific documentation there will be. I'm pretty sure that the documentation will be in the documentation center, but I don't know if program is anticipating any changes.
I think this one might actually be Kudzai. I think you talked a little bit about the upcoming changes to the MCPD file or the recent changes. Kudzai, do you want to speak to it on the call or take it back?
Sure. So I would like to provide an accurate answer to that. So I'm going to take it back and then get back to you. So it looks like the question is, let me see who it's from. It's from, is it Mary? Mary Ann?
Yeah, and
Okay.
Sanjay. And we
Okay.
collect, just so you know, we collect
Okay.
all of the questions that are being asked, and we can provide you kind of a round out of everybody who's asked. And so folks who are posting their questions in the chat, they are being collected, answered as possible, but also collected for subject matter experts to get to later. So if we don't get to it right now, we'll get to it later. And Jeff popped on with in general if there are changes.
I'm sharing a bit in the chat. So if the file itself, if we add values or other, make any changes to the data elements themselves, things of that nature, then the file layout changes and the accompanying schema is updated as well. We will provide updated documentation and an updated schema. They'll be made available in the documentation center or distributed in other ways if you have issues with the doc center. So in general, yes, anytime the file changes something that is physical data, if you will, that you would be reporting on the file, then there's a change to the schema and the documentation and the file layout itself. Or at the very least, the values that go into each data element. Benefit type is a good example. Yes, yes, Kevin, yes. No new fields, update in values. So that does require a change to the schema and to the, well, I take that back. Perhaps not the schema, definitely documentation. And I'll give you more, I'll follow up with more details on the technical side and share it through Amy's group for follow-up. And that's my story.
And I believe next we're going to go through communication and discussing who to contact for questions, answers, and to get access to things. Again, I'm the Managed Care Data Support Section Chief, and this particular part of the program is in every single webinar that we post. It is a little redundant, but the information is specific to each slideshow. So the documentation center access requests or data exchange at dhcs.ca.gov. And to get information about webinar, ask any questions that you need forwarded on regarding this webinar and this series, you can contact MCDSS at dhcs.ca.gov. For policy questions related to MCPD and PCPA, you definitely want to contact MCQMD at dhcs.ca.gov. And again, that's policy questions. If the message is urgent, do mark it urgent in the subject, and we appreciate that. We'll jump on it very quickly. The next steps are we're looking at all of the data collection status. Everything is actually in production, is my understanding, and maybe with the DMCODS in testing phase. Next page. Our resource page is the DHCS Quality Webinar Series webpage. You can see what it looks like on the left here. Those links include the webinar slides, the webinar schedule, the glossary of terms, and frequently asked questions. And again, that email that you can get to us and ask any questions that you need asked. When you go to the page and you click it, that should be the next page. you can see what I'm talking about. And all of these links in this webinar series, in the slideshow once we post it, those will be live links. So you can click into them, save them in your bookmarks, or just keep the slideshow handy. But this webpage is just rife with good information, training for staff, and all kinds of questions and answers about the production of the data that you are doing and giving to DHCS for use. So the Managed Care Data Quality Monitoring Series is below, and you can see all of the posts for the live information and recordings, as well as the transcripts, the slideshow, the glossary of terms used, the frequently asked questions, and any other information about the upcoming webinar schedule. Our next webinar will be a little bit later. We had this one a little early because we know people want to be away for the holidays, visit family. The next webinar will be January 31st in 2024 of the new year. This monthly data quality monitoring webinar series is usually held on the last Wednesday of each month, so we'll be getting back on schedule. So once again, the upcoming webinar schedule, you see that we just completed December, and the focus in January is the semi-annual data checks. It's kind of a big one. Going through February 2024, we'll cover behavioral health short Doyle. In March, we'll go over the qualitative data templates. And then in April, that will be our anniversary of the first webinar and the initiation of this webinar series. So that will be our annual address from our Deputy Director, Dr. Lynette Scott. In May, we'll cover any changes or new updates and information to the 274 medical managed care provider data. Next slide, please. In June, we'll go over the 274 mental health plan. July is a semi-annual data checks once again. August is the encounter data. September is the dental provider data. October, we have again a monthly data check, and it just goes over some of the common issues found in all of those semi-annual and monthly data checks. In November, we'll hit the 274 for the drug Medi-Cal organized delivery systems. So the plan is to just kind of recreate the year again, go through any updates and make sure everybody is aware of all the information that DHCS is asking you for. Are there any questions related to that or the schedule? You can put them in the chat here. And if not, I can give you back the rest of your day. I want to thank everybody again for attending this and being part of this every month if you are attending every month. And we'll see you in January. Happy New Year.
Thank you.
Thank you, everybody.
Bye-bye.
Thank you.
Thank you.